door is closed, my hands are washed, and my name is Logan. I'm going to be your nurse practitioner student today. What is your last name and date of birth?
Nucci, 12/4/1996.
Beautiful, thank you. I'm going to be doing an assessment on you today. Is that all right? Okay. My focused assessment is specifically going to be on your head, your eyes, your ears, your nose, your throat, your mouth, and your neck. And just assessing for any abnormalities. Do you wear any contacts or corrective lenses?
No.
Good. Do you have any concerns with any of those areas?
No.
Good. Any pain today?
No.
Good. Okay. So I'm, once again, my hands are washed. I am going to just first assess your skin, which appears to be pink, dry, free of any lesions, no rashes, no petechiae, no erythema. Is it okay for me to touch? Okay. Just gonna take your arm here. Beautiful. So skin is warm and dry, consistent with ethnicity. I'm gonna just check for your skin turgor. So I'm gonna pinch the skin in between my finger. And perfect, it recoils nice and quick, so it's a brisk recoil, no tenting noted, so no signs of dehydration. And then just your nails here, good. Nail beds are pink, they are smooth, no signs of clubbing or cyanosis. Just checking your cap refill, so I'm gonna push on one fingernail here. Good, it blanches and then returns briskly back with its pink red color. So capillary refill is brisk, less than 2 seconds. I'm just going to assess your head here. So I'm just looking, so your head is round, it is symmetrical. I'm going to look at your hair so you're going to feel me touch. So looking in the hair, there's no sign of festation, no nits, no lumps, no pustules. Even hair distribution, hair feels soft to touch, no patterns of like any baldness, and no masses or lumps have been felt, and no depression felt in the head. So head is normocephalic, atraumatic, things good there. You're gonna feel me just palpate your temporal artery here. Perfect, so those are equal +2 bilaterally. Any pain there? Good. I'm just gonna touch, feel your temporal mandibular joint. Any pain in there?
No.
Good. Have you open and close your mouth? One more time. Good. Any pain?
Mm-mm.
Okay. No crepitus, no clicking heard. And I'm just gonna assess your neck here. So, even pigmentation, no signs of jugular vein distension, no masses noted, skin is intact. Just looking at your trachea here, you're gonna just feel me touch. Good, trachea appears to be midline, no masses or nodules felt. I'm gonna assess your thyroid, so I'm gonna go behind your back. You're gonna feel me place my hands right kind of below the carotid artery here. So I'm just gonna feel some gentle pressure. I am gonna have you swallow in just a moment, and let me know if there's any pain with that, okay? Go ahead and swallow. Good. So thyroid, I think this is palpable, no nodules noted. Any pain there? Good, it's non-tender. I'm just gonna assess your sinuses. So I'm gonna start with the maxillary. Okay, no sign of swelling. Any pain or tenderness in here?
No.
Good. And how about in your frontal sinuses? Any pain or tenderness in there?
No.
No pain or tenderness in either one of the sinuses, and neither one of them have any sign of swelling. So I'm just gonna feel for your lymph nodes next. I'm gonna start with the preauricular, right in front of the ears here. I'm gonna go to post-auricular, and then I'm gonna feel for occipital lymph nodes. Good. Coming back to tonsillar lymph nodes. Good. Submandibular. Good. And then submental, right at the chin. And we're gonna go down into the anterior cervical lymph nodes, into the posterior cervical lymph nodes, good, and then subclavicular, good. Non-palpable lymph nodes, any pain there? Good. Non-tender lymph nodes, good. So next I'm just going to assess your eyes. Before I do shine any lights into your eyes, I'm going to have you do the Snellen eye chart, which will assess your visual acuity and assess your cranial nerve number 2. So the Snellen eye chart, what I'm going to have you do is, normally this is on the wall, you're going to be standing 20 feet from it and read whatever line that you're able to read without any trouble. Cover one eye, and then we assess by, laterally and then together, and then basically that just assesses your visual acuity. But where this is not on the wall, I'm going to hold this ideally 6 feet from you. Once again, with the video, it'll be a little bit closer. But I want you to, are you able to see that bottom line?
Yep.
Perfect. I'm going to have you cover your left eye. And when you're ready, go ahead and read off that bottom line for me.
DHJBS.
Perfect. And then, go ahead. Perfect.
DHJBS.
Beautiful. And then go ahead and read those together.
DHJBS.
Beautiful. So we have this time cranial nerve 2 is intact. Visual acuity is 20/20. Alrighty. So now I'm going to just test your pupillary response here, and so I'm going to flash a light right into there. See my pen light. Go ahead and just look straight ahead for me, okay? Pupils are round and symmetrical bilaterally, and I'm going to just shine a light into this right here. Good. 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 So pupils are 5 millimeters, constricting to 3 millimeters with reflex, and both are equal and symmetrical bilaterally with direct and consensual light. And next I'm just going to test your ocular muscle and movement. So first I'm going to have you follow my pen light. We're going to do the 6 cardinal gazes. I'm going to have you keep your head looking forward without moving your head, just your eyes. Follow my pen light, okay? Good. So ocular motor function is smooth, no nystagmus, and intact. Next thing I'm going to do is I'm just going to have you gaze at something on the wall. I also would like to have you gaze to my pen light, and back to the wall, and to my pen light, and to the wall. Good. Pupil accommodation is equal bilaterally. And the next thing I'm going to do is another way to check your cranial nerve number 2 is I'm going to check your peripheral fields. So I'm going to have you close your right eye with one hand, and I want you to, I'm going to stand kind of in front of you, and I want you to let me know when you, what number I'm holding up in your peripheral, okay?
1.
And oh, so you're going to stare straight at me.
1.
Good.
2.
Good.
2. 2.
And your other eye.
3. 3. 4, 2, 1.
Good. So cranial nerve tubes intact. You have good bilateral peripheral fields, and they're equal bilaterally. I am now going to have you close your eyes. I'm going to place a soft object on your face, and with your eyes closed, I want you to tell me where you feel that soft object, okay?
Forehead, nose, left cheek, right cheek, chin, ear, left ear.
All right. Good. Now I'm going to just peek into your eye. I'm going to use my ophthalmoscope here. I am going to shine a light in there. Just peek. And let me know if you feel it's too bright. I'm going to have you stare straight off into right at the wall, or you can look right at my nose, okay? I'm going to get this on. Okay, so I'm going to touch, okay? So go ahead and you can once again look straight at my nose here. So I'm going at a 15-degree angle. I'm looking. So I do see my red light reflex here, and no obstruction. Your lens and cornea are clear. And then I'm looking. Retina is orange. I do see all structures. Good, very nice. So you're just gonna feel me touch. From what I can see, eyebrows are evenly distributed. There's no signs of hair loss. They're even, symmetrical to the face. Eyelids are, I'm gonna touch, see, free of any swelling, no lesions, no sign of drooping. Lacrimal ducts, I'm just gonna have you open your eyes for me, good. They're patent, no sign of drainage, no discharge. Sclera is white. I'm gonna just pull down. Good. Conjunctiva is pink and moist. Good. So next I'm gonna go to the ear. One thing I did forget while I'm so close to the ear is I do want to just listen to your temporal arteries. So I'm just listening for what we call a bruit, and I'm going to listen with the bell of my stethoscope. Good. No bruit heard, which is normal. Okay, perfect. Now I'm just going to assess your ears. So you're going to just feel me touch. But first, from what I can see, is ears are symmetrical with the head. They're evenly proportioned for the face. No signs of drainage from what I can visually see. No crusting, no redness or swelling. And I'm going to just check for pain or any tenderness. So I'm going to pull on the pinna. Good. Any pain there?
No.
And I'm going to pull on the tragus. Any pain there?
No.
And how about at the mandibular joint? Any pain there?
No.
Good. So all surfaces of the pinna, the tragus, and the mandibular joint are showing no signs of damage, or and also being reported as no pain or tenderness. So just gonna look. Well, first, I guess I am gonna perform on your ears. So the first one is called a whisper test, which is just to test your gross hearing. So what I'm going to do is I'm going to stand behind you, and I'm going to have you occlude one of your ears, so push on your tragus, and I'm going to whisper either a sequence of letters or numbers together, and I want you to repeat them and whisper them, okay? 7,
782.
7BC.
782.
Other ear.
469.
Good. Okay, so gross hearing is intact, equal bilaterally. The next thing that I'm going to do is not necessarily something that you are requiring because your gross hearing is intact, but this would be the Weber test here. So I'm going to use my tuning fork, and I'm going to place it at the top of your head. After I'm going to have it, it'll be a light vibration, and I want you to let me know where you hear it the most. Could be equal, or you could hear on one side better than the other. So I'm just going to actually use my knee.
Equal.
You don't hear it in any ear better than the other?
No.
Okay. So let's see here. So that is a good assessment. So your hearing is intact bilaterally. Well, and now, once again, you don't necessarily need this test, but this is something that we would test if you did have trouble with, unilateral hearing. So what I'm going to do is, this is called the Renee test. This is going to be a light vibration. I'm going to go right behind on your mastoid bone there, and I want you to say now when you can't hear the ringing anymore, okay? Say now when you can't hear it anymore, okay?
No.
Good. And can you hear that?
Yep.
Good. So I would test that. Typically, you would hear that much longer than you would on the bone. So typically that means that your the ear conduction is better than bone conduction, which is a normal finding, and that's good. And we did that bilaterally. Yes, hearing is equal bilaterally. No deficits there. The other thing that I'm going to do is take a look inside your ear with my otoscope here. We already established no pain, so you're just going to feel me pull back up on your pinna. I'm going to take a look in there. So far from what I can see, the external canal is free of any obstruction. Good. No redness, no drainage. I can see your tympanic membrane. It is pearly and gray. No signs of erythema, no signs of rupture, no drainage. I can see all structures of, good, I can see all structures of the tympanic membrane, and there is a good amount of light seen in there, and we did that bilaterally. So good, no abnormalities there. Good. And the next thing I'm going to do is I'm just going to inspect your nose. So nose, it appears to be midline. I'm going to just palpate, okay? Let me know if there's any tenderness. Any pain there? Good. No swelling in the nose, no obvious drainage that I can see. I am going to have you just assess your nasal passageway for any patency. Go ahead and take a nice deep breath in. Good. And I'll have you check the other side as well. Good. Both nares are patent. Next, I'm going to just test your olfactory nerve here, cranial nerve number 1. I'm going to grab two different items, and I want you to close your eyes. Without opening your eyes, I want you to approve one nostril, and I'm gonna ask if you can smell what it is. Go ahead and name it for me when you're ready. Go ahead and take it.
Vanilla.
Good. And with the same thing, eyes closed, opposite nasal. Good. And don't take a nice deep breath, but just kind of.
Cinnamon.
Good. That is correct. Cranial nerve 1 intact. I'm gonna just take a look inside the nose. To the light. So I'm just looking. You're gonna feel me touch. Good. Mirrors are free of any obstruction. No drainage at this time. Mucosa is pink, free of any lesions. And septum is midline, no sign of deviation. And I'm just going to have you smile for me. Good. And frown. Good. Can you pop out your cheeks? Good. And then go ahead and stick out your tongue. Good. Tongue is midline. From what I can see right now, there are no lesions on the lips. They're pink, they're moist, they're dry. Oh, they're pink and they're moist. Free of any cracks, any lesions. Go ahead and open your mouth for me. Good. Looking at the teeth, no signs of breaking, tooth loss, or decay. No sign of dental caries. Go ahead. I'm just going to look on the inside of your cheek, okay? And I've got gloves on, just so you know, sir. Good. Buccal mucosa is pink and moist. Go ahead and open your mouth, lift your tongue up to the roof of your mouth. Good. Frenulum is midline and intact. Go ahead and open your mouth and look at the top. Good. Go ahead and stick your tongue out for me. And I've got my tongue depressor. Given circumstances, I will not pedal down too hard. I'm just going to take a look. Tongue out and say ah. Good. Uvula rises midline with ah. Tonsils are +1. No redness, no tenderness, no signs of thrush, no white patches, no sign of infection in there. Looks good. And let's see. I feel like we run through it. Do you have any questions for me?
No.